Everybody, welcome to the annual state training for the MAA program. My name is Nikki Yates and I'm the LGA coordinator. With me, I've got Julie Newbold, Jessica Victorino, and our presenter, Les Hall. As you know, this is an annual mandatory training. It's scheduled to go for 2 hours, but we're going to try and get you out of here a little bit early. But regardless, please make sure and put 2 hours of MAA training on your code 20 for today. It's a little different format. So a couple of the main things that we need you guys to be aware of is that we are going to be keeping track of who is in the training by the Q&A. So please make sure that you have your Q&A enabled. And also please make sure that your name is showing up. As we go through the training, I am going to be manning the Q&A and publishing all the comments. Once I publish it, you'll notice, like, if your name doesn't come up, it'll say anonymous. That means we have no idea who you are because you truly are anonymous, and you will not get credit for this training. So as a kind of a roll call thing, what we've done is we've sprinkled 4 questions throughout this training. Please type the answers for the questions in the Q&A boxes. It's not a pass-fail. If you get them wrong, you're not going to fail. It's fine. You'll still get credit. But we're just making sure that people are here throughout the whole training, as that is a state requirement. Another thing that I wanted to bring up, a little bit different, that we're going to be talking about today is COVID-19 and how the activities that you're doing in maybe a new role that you have, little different, activities that we have right now going on. We have a crosswalk for you to show you how much MAA reimbursement you can still get, even if you are working within the COVID-19 pandemic and doing those COVID-19 activities. In the email, you were given the attachment for this training, and you were also given the COVID-19 crosswalk. If you don't have that with you, you can always go to our website and you can pull those up. Those are there too. So anyways, welcome everybody, and I'm going to introduce Les Hall. Hi, Les.
Good morning, everybody. Can you hear me okay?
I can.
Awesome.
Oh, Julie, I have a question. Is there a number that people can call in to listen to the training?
No, there is not a number they can call in.
Okay, I'm sorry, there's no number.
Everybody has to be signed in on their computer, according to this training. I think, right?
Yes.
Okay, all right, good deal. Well, good morning, everybody, and welcome to your annual mandatory MAA time survey training session. This, like Nikki said, we're going to be taking up to 2 hours to complete this training, and we also want to make sure that you all understand this is an interactive training. So anytime you have questions, please use your Q&A to ask any of those questions, so that we can get them answered and discussed right away. I think Julie might be answering a lot of the questions right as you type them in, but if she has any that come up that we want to talk about as a group, she will certainly let us know that. Okay.
Yes, I will be the questions, and then I will, after each code, I'll let you know if there's any questions for that particular code.
Gotcha. Nikki's got the question and answer section. Okay, very, very good. Okay, so this is the annual training that is for the 2021 fiscal year, which begins July 1. If you've been participating in MAA program previously, you know that we all have to be participate in time survey training prior to the new fiscal year. So this is that formal time survey training that you have to attend on a yearly basis. So next slide, please. This page gives all of the important contact information for the MAA program in Santa Cruz County. The top website address is the most important. That gets you connected to all of the MAA information and the time survey for Santa Cruz County. And then below that are the names of Nikki, the LGA coordinator, and Jessica and Sean and Julie, who are part of the coordination team for Santa Cruz County. And I strongly encourage you to contact any of them by email or phone if you have any questions with regard to the MAA program and your continued participation and the time survey and all of that stuff that's related to the MAA program. Next slide. Okay, so general overview. What is MAA? MAA stands for Medi-Cal Administrative Activities, and this program was created in 1995 in order to make the Medi-Cal program more efficient and productive for the state of California. The state of California provides fee-for-service reimbursement for all of the healthcare services necessary under the Medi-Cal program, but it does not pay for the administrative activities, which are actually necessary for the administration of the Medi-Cal program. And the federal government decided that it would be a good idea to reimburse everyone for their administrative activities that promote and connect everyone with the Medi-Cal program. So this program has been going now for 25 years, and it has gone through many different administrations at the federal level, and there has not been any discussion about removing or terminating this program. So we're still going forward with it just as we would normally every year. So feel confident that the time you spend doing your time survey for the MAA program actually does get you reimbursed for that activity. And what it means for your organization is that the time you spend goes into an invoice that is done on a quarterly basis, and the reimbursement that your agency receives because of your time survey participation brings in revenue that is unrestricted funding, meaning that your agency can use it for any purpose you deem fit within the boundaries of your service provision within your agency. So it's a great funding source that can be used to fill all kinds of different deficits and holes in annual budgets for items such as salary and benefits, attendance of conferences, purchase of vehicles, purchase of ancillary services and outside support that may be necessary for your organization and your client staff. So anything that your agency feels is important for the maintenance of your connection with people to the Medi-Cal program can be used, a source of this funding, use of this funding. Okay, next slide, please. Okay, so here we start with the first question of 4 that are going to be taking place throughout this presentation. The first question, which is very important for your initiation into this time survey training, is please respond in the Q&A section with your full name. And I'll give you a few moments for that. And it is not a trick question. It is your actual full name. Awesome. Thanks, Nikki. So thank you for the response to that first question. This page actually shows all of the MAA and TCM activity codes. So TCM stands for Targeted Case Management, and we are not actually participating in TCM for the agency in which you are attending this time survey training. We are only interested in the MAA codes, and those MAA codes are only codes 1 through 22. So we're not even going to be talking about codes 23 through 32 because those are all TCM codes. But within the MAA codes 1 through 22, we have a number of parallel codes that we actually aren't going to be talking about either because we don't have to use them. So codes 3, 5, 7, 9, 11, and 14 are parallel codes that we don't have to use, and those are the ones that we won't be talking about. In lieu of using any of those codes, which are all non-reimbursable, we will only be using code 1 as the only non-reimbursable activity code that we have to use. Okay, so it cuts down the number of codes that you have available to you in your time survey tremendously, and makes it a lot more simple, and hopefully will make it much more accurate as well. Okay, next slide, please. Okay, so we are actually going to be starting our time survey training with the first reimbursable code that we all have access to, and that's code 4 for Medi-Cal outreach. This is the activity where we are simply providing information to clients and people about the Medi-Cal program, encouraging them to apply to Medi-Cal, and encouraging them to seek Medi-Cal services. So the whole idea behind Code 4 Medi-Cal Outreach is that you are giving people information. That's all there is to it. Just giving people information about the Medi-Cal program, encouraging them to apply, and encouraging them to seek Medi-Cal covered services that they can benefit from. So this code is actually the reason why the MAA program exists. Giving people information and getting them into services, encouraging them to apply to Medi-Cal, encouraging them to seek Medi-Cal covered services. One of the things that took place just a few years ago was the Affordable Care Act in California. That meant that about 2 million more people immediately became eligible for the Medi-Cal program that had never had eligibility for Medi-Cal previously. So because there are agencies that participate in the MAA program, all of the time spent giving people information about the Medi-Cal program and encouraging them to apply to Medi-Cal all became reimbursable activities for that new 2 million people that became eligible for the Medi-Cal program in California. So it was a very big step in the MAA program due to the implementation of the Affordable Care Act. So again, code 4, totally reimbursable activity code, giving people information about the Medi-Cal program, encouraging them to apply to Medi-Cal, and encouraging them to seek Medi-Cal covered services. There are a number of examples given on this page, and because you all have access to this presentation now, I would strongly encourage you to read through all of these examples and then refer back to this presentation as much as you possibly need to in order to connect the dots with regard to your daily activities and the Medi-Cal outreach code. Any questions on code 4?
There are no questions as of yet.
Okay, code 6, referral, coordination, and monitoring of Medi-Cal services. This is the activity code that most of you actually participated in for the majority of your time. Code 6, getting people actually connected to healthcare services, coordination of those healthcare services, and monitoring and or follow-up of those healthcare services. So identifying and referring people to the healthcare services, coordinating services for your client populations, because most agencies that deal with populations where you are participating in a MAA program would generally be connecting people with which would be considered high risk populations, and those high risk populations generally have more than one issue that needs to be taken care of. So coordination of multiple healthcare providers for those clients is a really important aspect of the overall care and connection to those clients, for those clients to health related services. And then follow up or monitoring of those health services, making sure that your clients are actually showing up to their appointments, following up with the healthcare providers to find out if there's anything that you can do to support those clients with their ongoing healthcare needs. All of that is all reimbursable activity. One of the main things about Code 6 is that it is not specific to Medi-Cal clients. That means that you can perform Code 6 and code time to Code 6 for any of your clients that you are referring to healthcare services, coordinating their healthcare services, and monitoring of their healthcare services. It can be a code related to any client, regardless of their health insurance coverage. So Medi-Cal clients, Medicare clients, private pay clients, private insurance clients, veterans clients, any client that you work with where you are performing this activity 6 code can be coded to this reimbursable code 6 for referral coordination, monitoring, and Medi-Cal services. Now, one of the other activities that you can code to code 6 is when you have clients that need assistance with arrangement of transportation in order to get to a healthcare service. You can code that time that you spend arranging the transportation for your client to get to a health service in code 6. We used to have another code, which was code 10, but the state decided that we no longer can use code 10 for the specific purpose that was in place at that time a few years ago. So for the last couple of years, we have been coding any time we spend arranging transportation for your clients to code 6. So anything that you are doing in order to connect your clients, regardless of their health insurance, to a healthcare service can be coded in code 6 as a reimbursable activity. And that, again, does not have to be a face-to-face encounter with a client. You can be performing these activities outside of a client visit, and that may be a lot of the time you spend not actually being in front of a client when you're performing these activities. So anytime you are spending that type of time in referring, coordination, and monitoring of their healthcare services can be coded to code 6, along with arranging transportation. Any questions on code 6?
There was a question, Les, about code 6.
Yeah.
Does it apply when assisting youth families with COVID-19 testing? And I indicated yes. Is that correct?
Yes, absolutely. Only thing that you have to be aware of, and just as a general statement, anything related to COVID-19 is a health-related issue. Anything related to COVID-19. Now, some COVID-19 issues may not be a reimbursable activity because it may be considered direct patient care, such as testing for COVID-19 or an examination for COVID-19. But if you are referring people to the health service for an exam or for testing or for treatment, that can all be code 6. So anything related to COVID-19, we're definitely going to be putting that into a reimbursable activity code. We just have to determine which activity code. Is it the actual treatment or direct patient care of the COVID-19? If it's a direct patient care activity, then that's going to be either code 1 or code 2 for other programs, or direct patient care, which are non-reimbursable activities. And then anything with regard to referring, coordination and monitoring, follow-up of those COVID-19 activities, you can use code 6. But there may be other codes that we can use for COVID-19 activities as well.
Okay, and then we have one more question. So for probation staff, can only the driver claim code 6 when doing a 2-person transport activity? Or can both?
Okay, very excellent. Very good question. So, when transportation of a client is actually taking place, there are opportunities for coding transportation time. If a client has a physical or mental issue that prevents them from obtaining that health service on their own, then an attendant is necessary, then you can code that transportation, that assistance with that transportation, joining that client within that transportation as code 6. If the client does not have a physical or mental issue that prevents them from accessing that service on their own, you cannot code that time. If the client is a probation client and it is a client that you are transporting because they are still in some type of a custody situation, and if that's just the case, it's only a custody situation, I don't believe that transport of that client would be a reimbursable activity under code 6. Nikki, you want to jump in there on that?
I do believe that is correct, because we can't claim any MAA activities, I believe, for incarcerated people, right?
Well, we can, as long as it's within the first 2 weeks of incarceration and the last 4 weeks of incarceration. So there's a 6-week time span there at the most for any client that's incarcerated. The problem is that, are you providing that transportation for the client to get to a healthcare service because they're incarcerated, or because they have a physical or mental issue with obtaining that healthcare service? Two different issues going on there.
Okay. We don't have any more questions about code 6.
Okay, moving on to code 8, facilitating Medi-Cal application. This is exactly what it says: facilitating an application for the Medi-Cal program, assisting someone with the Medi-Cal application process, providing paperwork, providing the application paperwork, assisting them with understanding exactly what paperwork is necessary for the eligibility application process for the Medi-Cal program, assisting them with the online application. As you all know, you can apply for Medi-Cal now over the internet on the state's website. So if someone has a need for application process and they don't have a computer, they don't have a tablet or anything like that, and you assist them in your own office or some other place that has that application available to them, that's all code 8, facilitating Medi-Cal application. There are a couple of other application processes that actually connect people to the Medi-Cal application as well, such as the 1E application, the SDI application, the SSI application. Those applications actually create a connection to the Medi-Cal application kind of a behind the scenes type of way. So anytime you would be assisting someone with those application processes, you can also claim that time for in Code 8 also, because it is actually connecting them to the Medi-Cal application process as well. Now, one of the other activities that you can code to Code 8 is that if you have to arrange transportation for a client in order to get to the application process, you can code that arrangement of transportation for that activity to Code 8. Now, that's different from arranging transportation to a healthcare service, which would be Code 6. In this case, you are arranging or assisting an applicant, a client, in order to get to the application process for the Medi-Cal program. Not a health service, but the Medi-Cal application process. So anything with regard to connecting that client to the Medi-Cal application process can be coded to Code 8.
Okay.
Any questions with regard to Code 8?
Nope.
All right, that's a pretty easy one. Okay, our next question of the day. Which is not a MAA covered activity? And we're going to ask you to put your answer in the Q&A section so that we continue to maintain your participation in this time survey training. The 4 answers that you could choose from are A, addiction services, B, suicide prevention, C, nutrition services, or D, domestic violence counseling. Which of those choices is not a MAA covered activity? I'll give you a few moments to answer, provide your answer, and Nikki will let us know when everybody has put their answer in.
So it looks like we've got some confusion on this one, Les. So we're going to have to maybe talk a little bit more. And I know that this one was a little bit of a trick question, but I have seen quite a few people that maybe are a little bit confused, even outside of domestic violence. So let's maybe spend a little bit more time on this one.
Absolutely. So Medi-Cal, the Medi-Cal program reimburses for health-related activities. Included in those health-related activities are physical health, mental health, alcohol and drug addiction services, in-treatment facility services, and anything with regard to health services, also including dental services. So the question for this particular situation is which is not a MAA covered activity. So we're looking for the activities that are not health related. And addiction services are reimbursable activity services. Suicide prevention is a mental health issue, and those are reimbursable through the Medi-Cal program. Nutrition services is a food-related service. It is not a direct health-related service. The Medi-Cal program does not reimburse for nutrition services. Okay, so they do not reimburse for food. They do not reimburse for nutrition counseling. So C is actually the best answer. Now, domestic violence counseling is also a behavioral health issue in most circumstances. So it is sometimes not a MAA covered activity if you are sending someone to a domestic violence counseling workshop that is not prescribed by a healthcare provider. So that could be a non-MAA covered activity, but for the most part, it is a behavioral healthcare service, and it is going to be a reimbursable activity under the MAA program and reimbursed by Medi-Cal. So the most correct answer is C, nutrition services. because it is not a direct health related service.
Thank you, Les.
You are very welcome. All right. Next slide, please. Okay, so we are up to contract administration. So codes 12 and 13 generally are performed by government agency staff for the administration of contracts with outside agencies for the provision of healthcare services. So if you have oversight of contracts that your agency has with services for the provision of healthcare services for your clients, such as if you are a governmental entity and you are subcontracting with a community-based organization, also known as a CBO, for the provision of healthcare services for your clients, you may be coding time to code 12 and or 13 for contract administration. This activity code, contract administration code 12 and 13 is only allowed for governmental entities such as county governments or city governments. If you work for a governmental entity, you have availability in contract administration. If you work for a CBO, a community-based organization, you are not allowed to participate in contract administration activities as a reimbursable activity code. So for code 12, this is when you would have any activity within contract administration for contracts specifically for Medi-Cal clients and Medi-Cal covered services. It is very specific for just Medi-Cal clients. That means the contract language for the provision of healthcare services for your clients states that this is a contract for Medi-Cal clients only. If you are not focusing on Medi-Cal clients, but the contract that you are entering into and administering for your agency is for the benefit of all of your clients, both Medi-Cal clients and non-Medi-Cal clients, then you would use code 13. So contract administration for all clients, regardless of their pay source, would be code 13. So the activity involved is the same for both code. It's the direction of your client population. Are they Medi-Cal clients or are they both Medi-Cal and non-Medi-Cal clients? So code 12 is specific to Medi-Cal clients and Medi-Cal covered services. Code 13 is not specific. It is for the advantage of all of your clients, regardless of their health insurance source. So anything with regard to contracting with outside services for the provision of healthcare services for your clients may be possible in contract administration. The issuing of the RFQs, RFPs, RFBs for any contracts, the oversight of those contracts, the maintenance of those contracts, the follow-up to make sure that those contracts are being administered properly, and all of the aspects of that contract between your agency and the contracting agency could all be included in contract administration. The difference again, code 12 is specifically for Medi-Cal clients and Medi-Cal covered services. For code 13, it would be for all clients, regardless of their health insurance, both Medi-Cal and non-Medi-Cal clients for healthcare services. Okay. Any questions with regard to contract administration?
No questions.
Okay, next slide, please. Okay, we are up to program planning and policy development. So codes 15, 16, 17, and 18, all four of those codes are all based on program planning and policy development. This is the activity that we are all involved with that is for the benefit of increasing access to healthcare services for our clients. This is the activity that we most under code for reimbursable activities. We have the least amount of time for this inappropriately. There are generally a lot more situations where we could be coding time to program planning and policy development that we just overlook. So this is one of those activities that we really want to pay closer attention to. Everyone has the ability to have time in program planning and policy development. You don't have to be a supervisor. You could be any level of staffing within your agency in order to be connected to program planning and policy development. Code 15, program planning and policy development, are for all non-SPMPs involved in increasing access to Medi-Cal services specifically for Medi-Cal covered programs. Now, we're going to go into that a little bit more in more detail. Non-SPMP means that you are not a skilled professional medical personnel. That's what SPMP stands for. So if you do not hold a licensure or certification in the state of California for the delivery of healthcare services, you are not an SPMP. You would be using code 15 in order to provide that activity for program planning and policy development for specifically Medi-Cal clients and Medi-Cal covered services. If you do not work for a governmental entity, you only have access to code 15 or 17. Code 16 and 18 are for SPMP providers, MAA time survey participants that work for governmental entities. If you work for a CBO, you do not have access to the SPMP coding in code 16 or 18. You have to use code 15 and code 17 as non-SPMPs. Those are just the rules that have been set forth by the federal government. So again, code 15 is for non-SPMPs when you're actively involved in trying to increase access to Medi-Cal services for your Medi-Cal client population. Just as we discussed in codes 12 and 13 for contract administration, code 12 was specifically Medi-Cal clients and Medi-Cal covered services. Code 13 was for all clients with regard to health-related services. That's what we're talking about with code 15. This is the code that you would use when you are not an SPMP and you are assisting with the increase in access of services for Medi-Cal clients to Medi-Cal covered services. And those activities could include any time you are working on trying to just increase access to services in some form or fashion. Maybe you are involved with in a meeting with other agencies to discuss how to get more Medi-Cal clients into Medi-Cal covered services, closing gaps in those services for your Medi-Cal clients and Medi-Cal covered services, creating resource directories to establish which healthcare providers in your county or communities actually will take Medi-Cal clients as their in their client population for treatment of Medi-Cal covered services. So this activity can take place multiple times throughout your day. You may be working within this activity on your own. You may be discussing it with a fellow employee. You might be discussing it with other agencies. It's just all about increasing access to those Medi-Cal covered services for your Medi-Cal clients, closing those gaps that may exist between your Medi-Cal clients and Medi-Cal covered services. So anything with regard to that whole idea that you're trying to increase access to services for your Medi-Cal clients and Medi-Cal covered services can be coded to 15 when you are not a skilled professional medical personnel. Code 16 is the same exact activity, but you are an SPMP. You do have a licensure or certification for the delivery of healthcare services within the state of California, meaning that you are an MD or a DDS or a DO or an RN or PHN or LVN. Some forms of the mental health providers may be considered as SPMPs and some may not. So we have to investigate some of those distinctions in order to be considered an SPMP, as you may be working for a governmental entity. Remember that if you're not working for a governmental entity, you do not have access to codes 16 and 18, which are just specifically for SPMP status. The reason why there is a specific SPMP status is the federal government is willing to reimburse your agency for the extra amount of education that you have obtained becoming an SPMP, becoming a healthcare provider. So when you are involved in program planning and policy development, you are actually being reimbursed at a slightly higher reimbursement rate for your activity involved with program planning and policy development. Okay, next slide, please. If you are involved with trying to increase access to healthcare services for all of your clients and you are not an SPMP, then you will use code 17. I would estimate that code 17 is probably the most used activity code when it comes to program planning and policy development activities, because you are generally not going to be doing any increasing access to services specifically for your Medi-Cal clients. This means that you are going to be actively involved in trying to increase access to services for all of your clients, to healthcare services in general. Again, these are healthcare services. This is all about the Medi-Cal program and the MAA activity codes. We're trying to increase access to services that are health related. So anything you are doing that has any connection to your client populations, your general clients, to health related services is probably going to show up in code 17. Again, this is for non-SPMPs. If you are an SPMP and you are involved in program planning and policy development for all clients, then you would use code 18. So code 18 would be for specifically for SPMP, those skilled professional medical personnel that work for governmental entities involved in increasing access to health services regardless of clients' insurance coverage. It's going to be an advantage to all of your clients. Trying to get more clients into health services that are going to meet their needs and benefits and benefit them. And it's all about your general populations. Whereas in codes 4, 6, and 8, we were talking about connecting specific clients and specific families to health services. In program planning and policy development, it doesn't. We're not trying to work on specific clients. The work we're doing is going to be an advantage to all of your clients, to all of your communities, to all of your community populations. So just keep in mind that you can have this activity take place throughout your days on a number of different occasions. Okay, code 15, when you're not an SPMP, but you are working specifically with regard to Medi-Cal clients and Medi-Cal populations. Code 16 is for SPMP, specific to Medi-Cal clients and Medi-Cal populations. Code 17 is for all clients for Any questions with regard to program planning and policy development?
I do have a question, Les.
Yes.
So the question is, I just completed 20 hours of COVID-19 contact tracing. How could that be coded?
Contact tracing. That sounds like data collection, but it's also particular to a specific individual for contact tracing.
You want to think about it for a little bit, and maybe we can talk about it when we get to the COVID-19 crosswalk.
Yeah, let's talk about that more when we get to the COVID-19 crosswalk, because we might have the answer there.
Okay.
Yeah, let's think about that one for a little bit. That's an excellent question with regard to how to code. Yeah, go ahead, Nikki.
Oh, I was gonna say that's just a lot of hours, so it'd be nice to be able
absolutely. Yeah, 20 hours, that's a lot of time. That would be wonderful if we can code that to reimbursable activity. I would think that contact tracing is not actually a reimbursable activity within the Medi-Cal program specifically. It's not a health service being provided to a specific client. So it seems like we would need to be able to get reimbursed for those administrative activities in some form or fashion. So yeah, let's think about that, and hopefully we'll have some more clarity when we get to that COVID-19 crosswalk. Okay. Next slide, please. Okay, our third mandatory question for your participation: how often should you fill out your time survey? This is not a trick question. We are all responsible for maintaining our time survey, and it is important to do it on a very specific time completion basis. So how often should you fill out your time survey? If you are showing up as anonymous, then you do need to put your name after your answer when you are completing this question. How often should you fill out your MAA time survey? Okay, the answer to question 3 is daily. It is really important that you make every effort to complete your MAA time survey on a daily basis. And the reason why is because if you wait any longer than a day, you start losing the ability to remember exactly how you spent your day and all of the different times that you may have spent doing those specific activities during your day. So by completing your time survey on a daily basis, you are maximizing your memory by the amount of times and total amount of time you perform that activity on a daily basis. If you wait for a couple of days or a week or try to complete your time survey at the end of the month, you are definitely going to have a problem maximizing your time by remembering all of those different instances when you perform those reimbursable activities. So yes, daily.
I would like to add that it is a state requirement. Well, actually not a state requirement, it's a federal requirement passed down through the state, and anything but daily they do consider to be out of compliance, and technically they can not use any of the time surveyed if it wasn't done on a daily basis.
That's a very good point, Nikki. Very good point. Okay, moving on to Code 19, MAA TCM coordination and claims administration. In each agency, there may be one or a couple of people that actually participate in Code 19. This is the activity that is done for the oversight of the MAA program within your agency. Anytime you are assisting with the creation of claim plans, invoices, oversight of time survey training, you may be coding time to code 19. The liaison between your agency and Nikki and her staff could all be code 19 activity. But it's just a few people in each agency, maybe one or two at the most. That's the general rule between code 19 for code 19. It is just simply the oversight of the MAA program for your agency. Okay, questions about code 19?
No questions.
Okay, code 20 is the time you spend doing any type of time survey training for the MAA program. So just participating in annual MAA time survey training. So if you are already participating in the MAA program and you've been participating in the MAA time survey training in the MAA time survey already, then this whole amount of time that you are spending doing this time survey presentation will be coded in code 20. So it is not the only time of year that you are allowed to code time in code 20. Anytime you need assistance or follow-up or refreshing on how to complete your MAA time survey and the MAA time survey codes, you can code that time to code 20. Anytime you speak to your supervisor about coding time in code 20 appropriately, you can code that time to code 20. Anytime you may be asking a fellow employee about MAA time survey coding practices, that's all code 20 time. Anytime you reach out to the LGA coordination team, Nikki and her staff, for assistance with time survey coding techniques, you may be coding that time to code 20. Okay, so it's all about just making sure that you have all of the knowledge necessary to code your time appropriately for code 20 for the MAA time survey. Okay, questions on code 20?
Nope.
All right, moving on to code 21. General administration is a partially reimbursable activity code. This is activity that you spend performing tasks that are not specific to a program, but are just for the general maintenance of your employment with your agency. So you're attending staff meetings, you're doing things that just maintain your employment with your agency, such as completing your time cards, any human resource or employment activities that you may be participating in would be general administration. The oversight of program budgets for your agency can be coded at 21. Also included in code 21 is the amount of time you spend on a daily basis completing your time survey. This is where you code that time. So you are allowed a minimum of 15 minutes a day for completion of your time survey. So every day, if you are completing your time survey on a daily basis, you could have 15 minutes in code 21. This also includes the time you spend taking your paid breaks. So if you are taking a paid break in the morning and a paid break in the afternoon, those 15-minute breaks can also be included in code 21. This is where you would code that time for those paid breaks. So if you're taking a paid break in the morning and the afternoon and you are completing your time survey on a daily basis, you should have at least 45 minutes or 0.75 hours in general administration, minimally. That doesn't even include any of the other activities that could be included in general administration, such as um, general emails that you are corresponding, non-medical staff meetings, non-program specific staff meetings, monitoring of budgets, site management. If you are overseeing management of staff within your agency with regard to just general oversight of staff, that's all General Administration Code 21. We used to have a situation a long time ago that we were told that we couldn't have any more than a specific amount of time in general administration, and that just wasn't true at all. Whatever you have that fits into general administration is coded to general administration. There is no total amount of time that you can have in general administration. If you're doing activities that connect to the Code 21 General Administration Activity Time, that's where you code that time. Again, this is where you code your time for completion of your MAA time survey and for your paid breaks. Minimally, anything else that fits in Code 21 will go on top of that as a Code 21 General Administration Activity Code. This is a partially reimbursable code, so it is based on how you complete the rest of your time survey. If you have a lot of time in the other MAA reimbursable activity codes that we talked about, your general administration activity will reflect that. If you have minimal amount of time in those other activity codes, then your general administration code will reflect that as being reimbursed at the lower level. It's all based on how you complete the rest of your time survey. Okay? So general administration, time survey, completion, paid breaks, and anything that you do that just maintains your employment with your employer that fits into this general administration. It doesn't fit into any of those other program codes, time survey codes that we previously talked about. Okay. Any questions with regard to general administration?
Nope.
All right. Moving on to Code 22, paid time off. Another partially reimbursable activity code. So anytime you are being paid not to be at work, such as vacation time, sick leave, paid holidays, if your agency pays you for the attendance of jury duty, that's all going into paid time off. It could be a full day. It could be a half a day. It could be an hour. It could be a couple of hours. Anytime you post on your time card or this means of recording your time for your employer, it has to match what you put on your time survey. So if you put a full day paid time off on your time card, your time survey has to state a full paid time day off. If you put half a day paid time off on your time card, your time survey has to reflect that time for time. This is the activity where the state finds the most errors made in time survey participants' time surveys. They don't put in the actual amount of time that you have posted on your time card as the same amount of time posted on your time survey. So make sure that your time survey reflects the paid time off that you have posted on your time card on that daily basis. Any questions on code 22, paid time off?
Nope.
Okay, code 1 is the only non-reimbursable activity code that we are contending with. Anytime that you cannot code your activities to any of the other activity codes that we discussed, then it will go in code 1. Anything that does not have a health related nature is going to be put into code 1. Any of those social services activities that are not health related activities, such as educational, teaching, employment and job training, housing, nutrition services, child care services, any of those services that are not health related activities are all going to go in code 1 because they are not a reimbursable healthcare activity code. So one of the easiest ways to complete code 1 is on a daily basis, you complete all of the other reimbursable activity codes first. Summarize all of the total amount of time you spent doing those other activities, and then whatever's left over in order to meet the total amount of time that you coded to your time card for the day just goes in code 1. So if you've coded 7 hours of your day in the activities that belong to those reimbursable activities, and you have no other ability to code any more of your time in any of those other reimbursable activities, then just put it in code 1. So code 1 is the default code for any activities that you cannot put into any of the other reimbursable activities that we've previously discussed. Non-health related, they're just simply activities that are not reimbursable, and we are all going to have those non-reimbursable activities. Not all of our activities are going to be reimbursable activities within the MAA program. Any questions with regard to code 1, non-reimbursable activities?
Nope.
Okay, moving on. This activity worksheet shows the COVID-19 examples of how you may be coding time for COVID-19 related activities and how they code to the MAA related activities. So anything with regard to the delivery of healthcare services with regard to COVID-19, you're testing clients for the COVID-19 virus, conducting laboratory tests, delivering any types of health service to those clients for COVID-19 related issues. Time spent tracking medical supplies for COVID-19. That's all part of non-reimbursable activities or direct patient care. That's all code 1 or code 2. Anytime you are providing outreach for healthcare services with regard to the COVID-19 pandemic, connecting people to healthcare services for the treatment of COVID-19, that's all outreach services, or it could possibly be referring, coordination, and monitoring of services where you are connecting people to those services directly. You're helping those clients make those appointments with healthcare providers in order to assess for the COVID-19 virus or the treatment of COVID-19 related health issues. That could all be referral, coordination, and monitoring. Anytime you're facilitating the application to Medi-Cal because someone has not connected themselves to the Medi-Cal program, and they may actually have COVID-19 related issues they're presenting with. That can all be facilitating Medi-Cal application. And now we get down to the big area of COVID-19 is program planning and policy development. Well, we're trying to increase access to health services. with regard to the COVID-19 pandemic. For the past few months, we've all been involved in issues directly related to the COVID-19 pandemic and how to provide health services, how to coordinate all of the data involved in the COVID-19 pandemic in order to make better decisions in order to treat health clients for the health related activities involved in COVID-19. So here's where we're talking about analyzing data, preparing reports, infection data related to the COVID-19. And I think this is where we are probably going to get into that whole contact tracing with regard to program planning and policy development. It is not the delivery of the healthcare service. It is the collection of the data related to the COVID-19 infection. So I think anytime you are involved in contact tracing, you are collecting data with regard to that COVID-19 pandemic virus. So I believe that it would be appropriate to code any of that contact tracing data to COVID-19. So the earlier example we talked about where someone spent 20 hours involved in contact tracing, it appears that all of that can be coded to program planning and policy development. Nikki, how do you feel about that?
I feel great about that.
Okay, we have an agreement from your LGA coordinator, who is the person responsible for the oversight of your MAA program for the County of Santa Cruz. So we have a good response there with regard to the connecting of that particular activity to program planning and policy development. Anytime you're involved in contact tracing for any clients, code program planning and policy development.
It was
more than likely code 17.
Even the training for being able to do the contact tracing?
Oh, I think so. Absolutely.
Okay.
You know, that's a really good point, Nikki. Anytime you are receiving or giving training that pertains to a specific MAA-related activity, you can code that time for giving or receiving that training to that activity code. So if you are receiving training that gives you more understanding of how to perform contact tracing for COVID-19 contacts, then you can code that training time you're involved in that activity code. So if you can code that time, if that relates to code 17 program planning and policy development for non-SPMPs for all of your clients, regardless of their health insurance, the training you would receive for that contact tracing can go in that code 17 as well.
Great, thank you.
Okay.
Can you also cover, Les, a little bit about staff meetings and how there's some opportunities there to
absolutely
code?
Yes, absolutely. Thank you, Nikki. Anytime you are involved in staff meetings, you may have opportunities for MAA-related activities that could be multiple different types of activities in those staff meetings. Let's just say that you're attending a staff meeting and you're all discussing a specific client, in that staff meeting. You may all have opportunities for code 4 or code 6 within that staff meeting if you're discussing a specific client within that staff meeting. If you are all talking about increasing access to health services for your clients, or even maintaining access to health services for your client populations, you may all have program planning and policy development activity codes in that staff meeting. One of the things I've always tried to get people to do with their staff meetings is always put the MAA time survey as an agenda item, as the last item in all of your staff meeting agendas. That way you all have the opportunity at the end of that staff meeting to discuss how you should all be coding your time for that staff meeting. There are some activities that may just be general administration in that staff meeting. There may be activities that are not related to healthcare activities in that staff meeting, where you're talking about nutrition services or housing services for your clients. Those are all going to be Code 1 activities as non-reimbursable. But anytime you're talking about health service activities for your clients, then you are talking about activities that are more than likely going to connect with these reimbursable activities in the MAA program. So program planning and policy development activities may be part of every staff meeting that you attend. But there may be opportunities for other activities, such as referral coordination and monitoring of those health services that you're being part of in those discussions within those staff meetings. So there may be multiple opportunities for coding activity time within those staff meetings. Now, the other time that we also need to cover that could potentially be reimbursable activity time is your own personal transportation. When you are using or being paid for your transportation to use while you are working, that means you are being paid to drive someplace or to be transported someplace for your job. You have to code that time as well because you're being paid for that time. So the time you are spending in that transportation for your job is coded to how you spent your time where you went for your job. So that may be time you spent with a client doing different types of activities, which may be reimbursable activities as well within this MAA time survey. Any transportation time that you had would relate to how you spent your time with that client. So maybe a portion of your time with that client was reimbursable activity, and a portion of that time was non-reimbursable activity. The time you spent with your personal transportation would be related to how you spent your time with that client. If you went to a meeting, no matter where it was, if you're being paid for your travel to that meeting, then you have to code that all of that travel time, how you spent your time at that meeting. If that meeting was spent doing activities related to increasing your understanding of access to health services, then your travel time would relate to those activities, potentially program planning and policy development. So all the time you spend doing your travel to get to those locations has to be coded how you spent your time at that location. It's proportional how you spent your time at that location. Any questions with regard to your travel time?
There are no questions.
Okay. Don't forget to code your travel time appropriately. You can also be losing out on a lot of potential reimbursable activity time with your travel time. Okay, next slide, please. This is a slide that shows all of the potential healthcare services that can be covered by the Medi-Cal program. So when we say health services covered by the Medi-Cal program, this is a general description of those health services provided by the Medi-Cal program for clients that are Medi-Cal clients. So physician services, chiropractic, allergy care, pharmaceutical services, dental services, occupational therapy, physical therapy, skilled nursing facility services, home health services, hospitalization services, lab services, maternity and newborn care, which could also be emergency Medi-Cal services. So someone might not be eligible for regular Medi-Cal, but they may be eligible for emergency Medi-Cal. Any of those services would be covered under the Medi-Cal program. Dental, vision, long-term service and supports, transportation services for emergency services is generally covered as a direct client benefit. So those could potentially be Medi-Cal covered services as well. Okay. Next slide, please. This is a handout that you may have accessible to you for handing out to clients in Santa Cruz County. It could be used as Medi-Cal outreach. So if you have something like this, a flyer or a handout or pamphlet that you can hand out to people in a direct face-to-face setting or at a community health event or any type of an event where you're going to be interacting with people and you're handing this out, you can use that time and effort under Medi-Cal Outreach Code 4. So it is potentially reimbursable activity anytime you are handing out this type of information to people about the Medi-Cal program and encouraging them to apply and encouraging them to seek Medi-Cal covered services. Okay. Well, we have come to the end of this annual mandatory time survey training. If you have any other questions, you may feel free to do them in the Q&A at this time. And there may be some last minute questions coming in that we can answer. But at any time, I just want to encourage you to connect with your supervisors or other people in your organization to ask any questions with regard to your MAA time survey. Connect with Nikki and her staff by email or telephone. They are excellent at getting back to you in a very timely manner in order to answer any questions you have with regard to your time survey. Keep making sure that you complete your time survey on a daily basis. That is really, really important. And thank you very much for your participation.
Yes.
Anything you'd like to add, Nikki?
I would like to say thank you very much to you, Les. Really, this is not a fun training. We know everybody has to do it, but you make it very pleasant, Les. So thank you very much.
Oh, you are absolutely welcome, and I appreciate your comments. And if anyone has any comments with regard to the training itself, you may ask those or put that in as well.
Absolutely. And just a huge shout out to Julie and Jess, especially Julie. She has done a great job of putting this all together and making sure that it ran as smoothly as possible. So thank you, Jules.
All right. Thank you, everyone.
Bye.
Bye-bye. See y'all later.